laws. We tax cigarettes in order to keep people from smoking. I don't think the point of taxing healthcare is to keep people from going to the doctor, but in fact, that is likely to be the impact. Employers are looking at this tax. In some cases, it can take quite a toll on their bottom line, and the result, of course, is going to be they're going to go to their employees and say we have to raise deductibles or copays. We've got to do something to avoid this tax. That is going to that goes right at the employees, the consumers of healthcare, the workers. And my guess is if they have higher copays and higher deductibles, they're going to go to the doctor less often. That has been the case in the past. If they go less often, you're either going to have people who are sick when they don't need to be, or you're going to have people spending more money in emergency rooms. So as a policy matter, this just doesn't make a whole lot of sense to us.
First of all, we have to keep in mind that the first reason we have this tax is to help pay for health reform. We don't have taxes just for the sake of having taxes. We want them to pay for certain things. And one of the key features of the Affordable Care Act was the goal that it not add to the deficit. And this is one of a number of taxes that helped achieve that particular goal. But secondly, in addition to that, the tax is an important tool for slowing the growth of healthcare spending. The Congressional Budget Office has identified limiting the tax exclusion for employer-sponsored health insurance as being one of the two most powerful policy levers that the federal government has for encouraging changes in medical practice and ways to make it more efficient. And as such, the inclusion of the tax in the Affordable Care Act was critical to CBO reaching its conclusion, particularly that the Affordable Care Act would reduce the deficit by an amount equivalent to about 0.5% of GDP during its second decade.
Excise tax, Cadillac tax, is a stealthy way to tax individuals. It's going to have an impact on individuals. Even though it's sold as a way to tax plans or to tax companies, it really is directed at individuals. And we did an analysis at American Health Policy Institute that said from 2018 to 2024, the excise tax could cost 12.1 million employees an average of $1,050 in higher payroll and income taxes per year if employers do what Paul V. was saying and actually increase the taxable wages. So if taxable wages are increased, that's a tax hike on individuals. Alternatively, if they don't increase wages, so that's the Bill Samuel thesis, then these employees could see up to a $6,150 reduction in their health care benefits with little or no increase in their pay. Either way, the individuals, the employees, are getting hit.
So the Cadillac tax has its flaws. It has its problems. I'm concerned about how it's going to hit health savings accounts. I'm concerned about how it's going to impact on-site health clinics that employers are using to prevent people from having to go to a doctor's office, take time off, have those kinds of adverse economic effects. And I also think we should be encouraging more choice. I mean, we shouldn't just be pushing patients and people into high-deductible health plans just because that happens to be the best tax strategy for the employer. We'd like to see more choice there. And at the end of the day, what we're going to have to do is make the entire healthcare system around the patient and the employer much more competitive, much more transparent, much more consumer and patient focused to ensure that these consumer-directed plans actually work. So the world isn't perfect, the Cadillac tax isn't perfect, but for the most part, it's actually doing what its advocates thought it should try and achieve. Thank you.